To be honest with you, I wish I wasn't here this afternoon to talk about what I'm going to talk about, but let's examine how our national and Texas health status compares to other nations and states. In some indicators, we rival so-called third world countries and compare poorly with others. I'm going to ask for your help in requesting and, in fact, demanding that our state officials do better. So let's begin. These are pictures from ProPublica and NBC News of women who are no longer alive, who died of maternal mortality, leaving children, spouses, and other family members mourning and behind. One example, this is Michelle Zavala and her newborn and her husband, Chris. He took her and his newborn daughter to a Texas urgent care clinic to try to save Michelle. It was July 26th of this year, just 8 days after she gave birth. They had rushed her in after Michelle complained of tunnel vision, of feeling like she was going to faint. Her eyelids were drooping, and her expression had turned listless, and she wasn't saying anything. A nurse looked at her and yelled for assistance. Chest compressions were performed, and she was intubated. But it was too late. Just over a week after she welcomed her daughter, Clara, in a routine labor and delivery, Michelle died of a preventable pulmonary embolism at the age of 35. Let's look at some of the conditions that make these tragic tests possible. And let's see how badly we're doing, how poorly we compare. We are frequently a world and national cellar dweller. What we find is a mortality cascade, where a lack of health insurance becomes a lack of access, which means not getting necessary care, and people die of treatable illness, resulting demonstrably in Texas in increased maternal deaths. Here's the key indicator: health insurance coverage, that dictates whether or not people can access health care, including prevention. We are 34th out of 35 nations in the Organization of Economic Cooperation and Development, the OECD, for having health insurance coverage. And Texas uninsured is the worst in the United States. Texas, by the way, was one of a minority of states to reject the Affordable Care Act's expanded federal Medicaid dollars, which would have given us $10 billion over 10 years to help insure people. If you can't afford or get health insurance, you usually can't get or afford health care unless you are in active labor or have a medical emergency. You have to forego necessary medical care if you need due to its costs. Over a third of our national population is foregoing needed medical care due to costs, and Texas, once again, is almost the worst state in the nation. Thank God for Mississippi. When you're forced to forego necessary care, you have death. Yes, people actually do die when you forego necessary medical care from conditions that could have been treated and their lives saved. This is called mortality amenable to health care. Once again, our country fares poorly, ranking 26th among the OECD nations. And Texas is one of the worst states in the nation, at 38th in deaths that could have been prevented by receiving health care services. The lack of basic health care can have deadly consequences for women throughout the U.S., and especially for Texas women. The U.S. is tied with Iran, yes, Iran, in the world, and is one of the few countries, including Chad, Afghanistan, Botswana, and others, where maternal mortality is actually increasing, and the only developed nation where it's increasing. In Texas, our recent maternal mortality is shameful and scandalous. You can see from the map, the dark blue, that we are among the worst states in the U.S., and Texas maternal mortality has doubled in 2 years, from 18.6 to almost 40 in 2012. And by the way, this coincides with Texas slashing funding for low-income women's health services by 2/3, 66%, denying many pregnant Texas women access to wellness, preventive, and prenatal and postnatal care. Meanwhile, the California maternal mortality rate, that's in the blue, dropped by almost 1/2 or 50%, from 14 down to 7.3. So what has been done, or is being done about this by Texas and California? Well, in Texas, our elected officials gutted the funding for low-income women's health clinics, closing 80 clinics, causing the closure, I should say. Our politicians, again, refused $10 billion from the federal government to expand Medicaid health insurance for our low-income residents. Our legislature decided that the maternal mortality problem needed to be, what? Fixed? No, studied by a task force, as demonstrated by the title of the legislation. The bill title is Relating to the Creation of a Task Force to Study Maternal Mortality and Severe Maternal Morbidity. And Texas continues to study the problem. Here, for example, are the recommendations of the most recent Texas Task Force Joint Biennial Report. Increase access to health services the year after delivery. I'm not sure how that's supposed to prevent maternal mortality and morbidity. Increase awareness of health disparities and start programs that increase the ability of women to self-advocate. What, I'm not sure. Who to, who with, etc. I'm not sure. Increase screening for and referral to behavioral health services. That's great, but we don't have the clinics and the professionals to actually provide behavioral health services. Increase staffing resources. Now that sounds good, but it's for the task force. 5 and 6 really are concerning. Improve the quality of death reporting and investigation, and improve the quality of death certificate data. What the hell? Let me get this straight. Texas women are dying, and the appointed task force is focused on improving reporting and data? The CDC and the World Health Organization can already tell us why women are dying of pregnancy-related illnesses. These recommendations are very discouraging. Discouraging because the recommendations are to be charitable, very soft. It's hard to see them having any tangible, concrete impact preventing Texas maternal mortality and morbidity in the foreseeable future. Now let's look at what California has done. First thing is to understand that California officials in general, decided the health of their population and pregnant moms was important. They were the first state to establish an Obamacare marketplace or exchange. They did not slash women's health services funding. They did accept federal dollars and expand Medicaid, and they formed the California Maternal Quality Care Collaborative and concretely, effectively addressed some of the causes of maternal mortality. This collaborative created maternal toolkits to improve health care for leading causes of preventable mortality among pregnant and postpartum women. I urge you, in fact, to get on your computer and look up the California Maternal Quality Care Collaborative. These toolkits include ones for prevention and care for OB hemorrhage, the largest killer until recently of maternal death, preeclampsia recognition and response. They also have other important prevention toolkits in process, such as cardiovascular disease and maternal deep vein thrombosis, such as the pulmonary embolus that killed Michelle Zavala. All prevention toolkits include detailed best practice tools and articles, care guidelines and checklists, OB crash carts inventory lists, implementation guides and flow charts, and professional education slide sets. It's very concrete, very detailed. As we saw, since the collaborative's inception and the other actions the state has taken, California has seen its maternal mortality dramatically decline by almost 1/2. Let's go back to where we started. Pregnant women are dying. There is a mortality cascade where a lack of health insurance leads to a lack of access, which leads to not getting necessary care, and this causes people to die of treatable illnesses and increases maternal deaths. By the way, this is on us. we're getting what we tolerate and allow to happen in Austin. The laws, the regulations, and the mortality that we accept. Lives are at stake, literally. When are we going to demand better? We have the power, and now is the time to educate our elected officials to call and visit our state representatives and senators, the governor and the lieutenant governor's office, to demand and advocate for Medicaid expansion and the resurrection and refunding of all those low-income women's health clinics that were open before defunding shuttered them. If they don't do that, if they refuse, throw them out of office. The time is now to attend the Texas Mortality and Morbidity Task Force meetings and demand that the task force partner with the California Collaborative to institute those concrete actions, much as Oregon and Washington have done with California as well. Also, now is the time to urge women to ask their OB if the hospital he or she delivers at has the California protocols and toolkits in place. If it doesn't, urge her to ask her doctor to find such a hospital or see if she can change her OB to one that does deliver at such a hospital. Again, the time is now. If we don't educate and demand better from the politicians and the task force, Texas women will continue to suffer deadly results, and our Texas wives, mothers, daughters, sisters, and other women are at risk of dying of childbirth, and they deserve better. If, as Texas singer-songwriter Willis Allen Ramsey sang in 1972, then Texas women is Texas gold, why are they being treated like tinfoil? Please help. Thank you.